Hi, my name is Ann Cook and I am here in Chennai, India, and wanted to share my experience of getting some dental work done here and dental tourism. I'm at the Acharya Dental practice in Chennai, and I just finished my exam for getting 2 dental implants, and it's been an amazing experience. About 3 months ago, I found out that I needed to get 2 implants, and it was going to be so costly to do in the United States. I'm from Bend, Oregon. So I found a friend that knew somebody here in Chennai, and they recommended the Acharya Dental practice to me. And initially I had a lot of fear and anxiety, and particularly when I started talking to my friends and family about the idea of coming to India to do some dental work. There were a lot of people that were concerned and had a lot of misgivings about coming to a foreign country to do that type of treatment. So I looked up the doctors online, and I looked through their profiles and read about them and checked in with other dentists in my country, in the US, and was so impressed with their qualifications. And then I also was able to talk to the doctor right away. When I emailed Dr. Varam, he responded really quickly, answered all of my questions, really settled my anxieties, and then I made the trip over here, and I've been so impressed with the treatment. The quality of the care has been excellent. There was, no pain in the surgery, in my shots, very patient in the whole process. I really appreciated how the whole staff explained the process, the procedure, the medications after, and Dr. Varam was very thorough in his explanations and in his exam. I was traveling with some friends from Saving Ganesh, and they all had their dental work done here as well, and it cost me such a minimal amount compared to what I would have had to pay in the US. It actually was a lot less expensive for me to fly here, do a month vacation and my dental work than it would have been for me to have the treatment in Oregon. So it's been an awesome experience. I'm very thankful for the dental practice, for Dr. Varam, and for the care that I've had here. And if you have any questions, I'd love to answer them for you, because my experience here has been amazing, and my colleagues can say the same thing. So we're going to show you a little bit around the dental facility, and do come to India, do your dental work, it's worth it. I'll introduce you to Dr. Varam, who just finished my treatment, and thank you.
You're welcome, absolutely.
So the thing that I loved about meeting Dr. Varam, again, I said upstairs, is that I emailed you, and I think within 30 minutes, and it was 11 o'clock at night in the US,
right.
And within 30 minutes you had emailed me back, and we were on the phone, and you were explaining the whole procedure to me.
In this clinic, we're definitely more conservative in our approach. Sometimes we like to wait and watch and see if something that looks suspicious, like a small cavity, is really a cavity, because sometimes they could just be stains. So it's not very, we don't like to aggressively treat everything, which is sort of the philosophy, I would say, in India and in Europe. But in the US, it's probably a little bit more, maybe cautious, you could say. And that's just a difference in the training, what exists. So I've had a little bit of both, because I trained here and then I trained in the US, so I've seen the best of both, and now I can kind of make my decision about how I would want to treat. Yeah.
Hi, I wanted to meet you.
Yeah, it's such a pleasure to meet you, Dr. Acharya.
I think my son has been looking after you.
Yes, he has, and I just had an awesome experience. And my friend Lauren here, I said, we gotta capture this for them, because I've just been so overwhelmed with such a great amount of service.
But when a patient comes from abroad, we got exposure to that. We say, okay, they're on a limited time, so we just try to see the best service possible in that time.
Yeah.
But we are not actively saying tourism or tying up with here and there or doing any of that, because I feel our focus should not change.
Yeah, yeah.
So we say, okay, they say, okay, 10 days. What can you do? Good work within this time. It's not like we just do it because they're there for 10 days and then they go. We don't want them to suffer. They go back to their own country, and then somebody's telling them, oh, you went to India and did your work, or something like that. So we want to give the best. So for that, he's the process artist. He has changed the way we are doing the labs. He's doing quality control from there. So I do the clinical work. I look after all the parents, grandparents, forefathers, great grandfathers, everybody. And because the practice is like that. There's so many years of family practice like that. At the same time, we're doing implants, a whole lot of aesthetic dentistry. There's so much of fun in that as well.
Yeah, really.